All right, let's talk about one of the most common and, frankly, one of the most frustrating injuries out there for anyone who loves to move, the infamous iliotibial band syndrome. You know the feeling, right? You're out on a run, you're in the zone, everything feels great. And then, out of nowhere, this sharp, stabbing pain starts up on the outside of your knee. It can literally stop you in your tracks and turn a perfect workout into a painful limp home. So, to really get a handle on this injury, we've got to start with the basics. We need to understand the anatomy. So, let's meet the main character in this whole story, your IT band. Okay, so the first thing you need to know is that the IT band isn't actually a muscle. Nope. It's this long, super thick band of connective tissue. It runs all the way from the top of your hip bone, that's the iliac crest, down the outside of your thigh to a little spot on the outside of your knee. Its main job? To help keep your knees stable every time you take a step. So that's the structure. Now let's get into the problem itself. Let's decode what IT band syndrome actually is. At its core, IT band syndrome, or ITBS for short, is one of the most common overuse injuries, especially for runners and cyclists. And that classic telltale sign is that very specific, very annoying pain right on the outside of the knee. And this diagram here really shows you what's going on. When that IT band gets overworked, it can get incredibly tight and, you guessed it, inflamed, right where it passes over the bone of your knee. And that inflammation is exactly what's causing that sharp pain every time you move. So how can you be pretty sure this is what you're dealing with? Well, the symptoms are pretty distinct. You've got that pain on the outside of the knee, of course, but here's the big giveaway. The pain often gets way, way worse when you're going downstairs or running downhill. You might also just feel a general sense of tightness all along the outside of your thigh. All right, so we know what it is and what it feels like. But the million-dollar question is, why? Why does it happen in the first place? Let's dig into the root of the pain. You know, it's almost never just one single thing. Repetitive activity is the main trigger, sure, but it's usually paired with some other underlying issue. We're talking about things like weak hip muscles, maybe some inefficiencies in your running form, or just poor biomechanics. And yeah, as we mentioned, downhill running is a classic culprit because of all that extra stress it puts on the knee. But those are all the contributing factors. What is physically happening down at your knee to create all that pain? Well, it all boils down to one simple, powerful concept: friction. And here is the big aha moment. As you bend your knee, that tight IT band has to glide over a bony bump on the side of your thigh bone. Now, the friction between the band and that bone is at its absolute highest when your knee is bent between 20 and 30 degrees. And guess what? That just so happens to be the exact angle your knee is at when your foot hits the ground during a run. Imagine that rubbing back and forth thousands of times. That's what's sparking the inflammation and all that pain. Okay, that's the problem. But the great news is that there's a really clear, really effective game plan for recovery. So let's walk through it step by step. First things first, and you cannot skip this step, you have to calm things down. That means taking a break from whatever activity is causing the pain and using ice on that sore spot. The goal here is simple. We gotta put out that inflammatory fire. Once that really sharp, acute pain starts to fade, we shift our focus to relieving all that tension. This means gentle, targeted stretching for the IT band itself, but also for all the muscles around it, like your glutes and your quads. This is totally essential for getting your flexibility back. And now we get to what might just be the most important long-term fix: strengthening. Remember those weak hip muscles we talked about? Well, doing exercises that target your gluteus medius, that's a key hip muscle, is absolutely crucial. A strong glute medius keeps your pelvis stable and level when you run. If it's weak, your hip drops, it yanks on the IT band, and boom, more friction. So strengthening it fixes the problem at its source and is your best defense against this coming back. And the final tool in our recovery kit is the foam roller. By putting some direct pressure on the muscles along the outside of your thigh, you can help break up knots and release tension, which helps the whole system move a lot more smoothly. So you've got rest, stretching, strengthening, and rolling. When you put all those pieces together, what's the real objective? What's the end game here? Honestly, the goal of this whole plan is incredibly simple. We want to get rid of the pain that's holding you back, and we want to improve how your body functions. It's all about getting you back to moving freely, moving strongly, and not having to worry about that nagging pain coming back. So there you have it, a complete breakdown of IT band syndrome, from what causes it to how you can fix it. Now that you have the entire roadmap laid out for you, the only question left is, which piece of your recovery are you going to start with today?